Very nice. So many people. So many people. Very nice. Very nice. Nice. Okay, switch off. Now switch off. One more question. Yeah. Now this switch is switch off. Down your hand. All of you down your hand. One more question I will. All of you down your hand. How many of you? One more question. How many of you feel that the classes are really useful? The explanation, everything is okay. Running very well. They are useful. Okay. Very nice. So many people. So many people. Nice. Okay. Again down. One more question. If you give me feedback like this, I will be very glad. Yeah, down. One more question. Yes. These are classes which are to be done, which are being done free of cost. And even after learning also, you have to do free service. How many of you are ready to do free service? If at all you are permitted. Free service. So many people are ready there. So nice. So nice. Okay, okay, okay. Thank you all. Thank you. Okay, now recording not started. We'll wait. Next.
Sir, recording started, sir.
Started. Very nice. Very nice. Okay, then we will start the class. Notes, Nagaraj, please note down the notes. Okay.
Yes, sir.
Join after 10 minutes.
Okay.
Sridham will join after 10 minutes. Okay. My audio and video are clear?
Clear, sir.
Yes. Okay, okay, okay. Now we will start today one medicine, another medicine. We have already told about Naxamamica, Pulsatilla, Lecasis, and another medicine, Bryonia we covered. Okay. Today's medicine, note down, Calcarea carbonica. Carb. Calcarea carb. Calcarea carb. Put the spelling, Nagaraj.
Okay.
Calcarea carb on the screen. Calcarea carbonica or Calcarea carb. Okay. First point. It is from mineral kingdom. It is from mineral kingdom. Lime, L-I-M-E, lime. Jyoti, switch off your video. From mineral kingdom, lime. Lime is what we use along with the betel leaves. This is one of the food items we use, consume in a very small quantity. It's from mineral kingdom, that is lime. Lime is essential because it is present in bones and muscles and other tissues. So lime is one of the very important items. The one to be very strong, we require in the muscles as well as in the bones. Lime will be there. Okay. Next. Best suited for people who are obese, and tend to be obese. Who are obese and tend to be obese. Already who are already obese. Calcarea carb. On seeing the patient itself, you can tell that it is calcarea carb. And generally, calcarea carb people will become obese. It does not mean that for lean people, we should not give calcarea carb. For other symptoms tally, we can give calcarea carb. This is one of the features that the person is. Next. Result of Over usage of light. Result of over usage of light. There are some people who are habituated to take pan or this gutka masala. They give this one and put it like this and do like this and they eat. So in villages, people used to have bitter leaves along with the lime. Too much like it. So entire system will become, all the bones will become brittle. A small injury, they will break the bone. Care Nirmala, switch off your audio. You don't give me chance to remind it is being recorded. You keep your audio and video mute. Why are you disturbing me? I don't know. Today is the 14th class. You should learn to be silent and switch off your video and audio. Okay. So people who are habituated to take more lime. This is one of the reasons when you take what the provings have done. They have taken raw material in quantity and later they got the developed the symptoms. Same calcare carb also is the outcome of such. Next. Light complexion, pale, P-A-L-E, pale, weak, W-E-A-K, weak, timid, T-I-M-I-D, don't note down that out. No problem. Easily tired, easily exhausted. Calcare patient is obese. Generally, people who are obese will easily get tired. They want to do work. Bryonia will not do work. Bryonia people are lazy. But calcare people will be always doing something. But they do and they get weakness. They say that I am very weak, I am exhausted, I cannot do any more work. Like that. That you must understand. Okay. So appearance is light complexion. People are pale, they are timid. Timid is applicable for children also. They don't go on their own to the bathroom as a light is required, or somebody should come with them. That is one symptom. Then they're tired easily and exhausted. Okay. Next. Children with, next point. No doubt. Children with red face. Children with red face. Flabby muscles. Red face. Flabby muscles. Large head. The head will be of larger size child. Large head. And large head. So, calcare carb, seeing itself, we can find out calcare carb. These are all the features where we can identify the patient while taking down the case. The observation of the doctor is very, very important. That you must understand. Flabby muscles means muscles are very weak and will become brittle very soon. Just loose muscles. Okay. Next. Sweating is a major symptom, particularly in the head. Sweating is a major symptom, particularly in the head. This is one of the very important symptoms of calcare. Sweating will be there. Pillow gets wet in the nights. Pillow gets wet. Pillow gets wet in the night. Flabby means more of a soft tissue than muscle. That is why they look obese. Okay. Pillow gets wet in the night. That is, in the head, sweating is more. Not only in the head, total body sweating will be there. Calculated curve. Again, because of the obesity, they get more sweat. That is one of the reasons. Okay. Next. Frequent attacks of cold. Frequent attacks of cold. Frequently, they are supposed to, they will be getting cold. Particularly, I'm staying in Bangalore. So these problems we get in Bangalore because of the cold climate. The children will get frequent attacks of cold. Okay. Next. Sickly face. SICKLY. Sickly face. Face looks sick. Face looks sick. In girls, sick face in girls who are fleshy, that is full of flesh. Muscle is less, flesh is more. Flabby, same meaning. Plethoric, PLETHORIC. In bracket, would note down, hemoglobin is more, plethoric, more of blood, plethoric, more hemoglobin. And grow, GROW, and grow too rapid, T over too rapid. That is, a 10-year-old girl look like 14-year. You can see such people where the 9th class or 10th class by the time they're fully grown. And there are other drugs like glycopodium. They grow old. These people grow rapid growth, very rapid. They don't look old. Lycopodium people look old than their age. Okay. Next. Weak, WEAK. This is one of the essential symptoms Kalkarakar has. Weak. They can't do more work. They can't undertake much work, but they will be doing work. Weak, tired, 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 and anxiety. Some anxiety will be there. Always Kalkarakar will have some anxiousness. Something they want to do. Something. They are not at ease. Always something, some work there. So this unrest will be there with them. Weak, tired, and anxious, anxiety. I am retired but not tired. How am I getting classes, taking up classes? Though I am retired but not tired. There are many people who are working and tired. They are in the still job but tired. Calculator. Okay. Next. Cannot sustain prolonged mental work. Cannot sustain prolonged mental work. They cannot sustain continuous work. They will tell that patient will come and tell, sir, 5 hours, 6 hours I have to do, but I'm getting tired. I'm not able to do that. That they will tell them. Okay. Correct. Cannot. Right. Next. inability to apply himself. Inability to apply himself. That means he cannot put full work of him completely. Somehow something lacking, tiresomeness, weakness, inability to apply himself. You know, the tiresomeness is one of the symptoms. You cannot run a bracket. Next. Complaints from prolonged worry. Complaints from prolonged worry. You should know that three things trouble us a lot. This is complaints from prolonged worry. Suppose something happened in the family, some near and dear might have died or something. They will be thinking about it for years together. After some years, they become calculator. A prolonged worry of something which is not leaving them. There are three things which make the person sick: hurry, worry, and curry. Hurry, anything hurriedness is there, their mind is not at rest. Then worry about something always. Then curry means food makes the person sick. In fact, food is the one which is essential for the human to survive. We cannot live without food, that you know. But that food makes the person sick when the food is not taken according to the manual of instructions. I told you when we took birth, every machine, we are all machines. Okay? We are given one manual of instruction. What to eat, what not to eat, what to talk, what not to talk, what to do, what not to do. Clearly instructions are given. But we have lost the manual or we don't follow the manual. And if somebody wants to tell us also, we don't care them. Elders will be telling us, be like this, be like that. They will be correcting us. But if you listen to them, you will be normal. If you don't listen, you get sick. This is the calcare carbo. Generally will become sick because of prolonged worry. Okay. Prolonged worry. Next. Fear of madness. Fear that he may become mad or she may become mad. This also you can listen. You can observe the patient telling, sir, if it continues like that, I will be admitted to mental hospital, sir. They will be telling that they will become mad. Like that they feel. Okay. Next. Convinced that he is insane. Not only feeling or fear, convinced that he is insane. Insanity means mad only. He will declare that I am a mad, I am a mad fellow. They will tell. Convinced that he is insane. This also many people declare that I am mad, I am not well. My mind is not working. Like that they will tell. Okay. Next. Renu Gupta, switch off your audio.
ऑडियो बन गया
Comes to conclusions from emotions rather than intelligence. They come to a conclusion from emotions rather than intelligence. This is one of the symptoms of Kalkareka. They don't use their intelligence. Something happened, they will conclude. Okay. This is one symptom. You have to understand it as a symptom. Next point. Always doing some activity. Always doing some activity. Calcarea carp, that is one of the key symptoms. They will not sit quiet. Kitchen work or outside work or some other work or cleaning, this and that. Woman will be working or men will be working always. They don't want to take rest, though they are exhausted. It's nature. Ryonia is opposite. Ryonia will do 10 minutes work and half an hour rest. Calcarea carp, total half an hour work only. They will telling you should pursue, but they will be working. That is the symptom of calcarea. This is how you have to categorize or distinguish the patient. Okay. This is a very widely, no doubt, very widely proven drug. Widely proven drug. Having lot of symptoms. Widely proven drug. Having lot of symptoms. The stomach is slow in its action. The stomach is slow in its action. In bracket, food taken into the stomach remains. Food taken into the stomach remains. That is weak digestion. This is the symptom of calcarea. They take food, they say that still food is there in the stomach. It is not digested. They don't take much food, but they become obese. It is a symptom of calcarea. Weak digestion. Okay. Next. Very strong craving for XEGS. Very strong craving for XEGS. It is don't ask this question a vegetarian. Pure vegetarian don't ask this question. You must understand that the questions are to be put very discriminately. You cannot ask all the questions to all. Suppose you ask, are you married? Patient says no. Then you should not ask how many children you have. That you must be careful in asking the questions. Very strong craving for X. This is another symptom of calcarea. Okay. They will eat more. Next. Abdomen bloated. Bloated abdomen. That is the belly you can see, calcarea belly. You will get a doubt whether she is pregnant like that. Looks. Okay. Large head with emaciated extremities. Large head. With emaciated means very weak. శుష్కించిపోయిన సన్నగా అయిపోయిన extremities. కాళ్ళు చేయి. Hands and legs are very weak. Okay. But head is large. Next. Stomach is like inverted saucer. Stomach is like inverted saucer. I told you, I get a doubt whether she is pregnant. Calcarea carp, immediate on seeing we will recognize. Very easy. Next. Yeah. Much imagination leads to a passive state. Much imagination leads to a passive state in which he sits and thinks. He sits and thinks about small matters. Think, THINKS, thinks about small matters. So you'll be imagining something and sitting, and something is there on the table, like bending the pin or doing pen refill or something. Some people have done the putting cap and removing it, something. So about small matters, they'll be thinking. Okay. Next, he wants to sleep, but thoughts do not allow him. He wants to sleep. He's getting sleep, but mind is running full of thoughts. So he cannot sleep. He wants to sleep, but thoughts do not allow him to sleep. Okay. In the dream, dogs surround him. He will get a dream that dogs are surrounding him. So he'll get fear. It's a peculiar dream of Kalkareka. Whenever he goes to bed, he will get a dream. The dream is also surrounded by dogs. I'll tell you one joke here. One person has a dream that whenever he closes the eyes, he will get a dream that somebody is there under the cot, sleeping on a cot. Double cot bed is there. Then immediately we wake up and see whether somebody is there or not. This disturbs his sleep. Every day this is the problem. So he went to several doctors. Nobody could help him. Somebody has given sleeping tablet, but that is not good for health. So he went to a psychologist. Psychologist, okay, no problem, we will give you counseling. What we do as psychologists, we will convince him that there is nothing under the cot, this and that. We'll tell. This fellow also went to a psychologist. The psychologist said that it requires 4 or 5 sittings. Each sitting around 10,000 I will charge. Something like that. So he was worried about the money also. Then he went to one of his friend's house. Friend has given an idea. So the psychologist was waiting for him. He did not come for consultation. So on the road he met him and asked for a psychologist. What, sir, you told that you will come. You are getting a regular dream of somebody lying under the cot. Why you are not? No, sir, I got it cured by my friend without spending a rupee. The psychologist was anxious to know what is the medicine, what is the remedy he has told. Just told, sir, he asked me to remove the cot and sleep on the floor. When cot is removed and started sleeping on the floor, the cot, 50,000 saved. We psychologists do like that. This also, Kalkareka wants to sleep, but thoughts will be coming. Dreams of dogs surrounding him, crowding him. Next, full of fears. Some fear. Kalkareka always has some fear will be there. Full of fears. Then disgusted of life. Disgusted of life. Not life. No, how to do it. Like that he will tell about Kalkareka. Disgusted. Next. Hopelessness and anxiety. Hopelessness and anxiety. This is one of the recurrent symptoms. Full of fears, disgusted, hopelessness, and anxiety. Good. Right. He's a pessimist. There are two types of people, pessimist and optimist. Optimist always finds an opportunity in every difficulty. Every difficulty is an opportunity for optimist. Every opportunity, there is difficulty for the pessimist. He will always see the difficulties in the opportunities. But an optimist will always find an opportunity in every difficulty. So this is one of the important points we should learn in life. You will not get opportunities easily, but once you get the opportunity, find it out, do it. Don't worry about the difficulties in the opportunity. Then you have to plan such a way. Okay. Next. Every small thing is a big thing for him. Every small thing is a big thing. Very, very trivial matter, but he feels it is very serious. Small things also become serious. Okay. Next, important point. Late learning to walk. Late learning to walk. And late walking because of weakness of muscles. Physically, muscles are weak, hence he cannot walk. Calcare carb, muscles are weak, hence he cannot walk. There is another drug, Beretta carb. Muscles are strong, but he cannot walk. It's a late learning to walk. That will also. But this fellow is because of the weak muscles. Late learning to walk. Okay. Next. Next point. Bones bend. So you can see some people walking like this. Bones bend. They can't work straight. And spinal cord also is weak. Bones bend. Next. In children, teeth problems. Teeth are very weak. Weak teeth, tooth. Okay. Weak. In extreme cases, no teeth are formed for the child. Calcare will make the teeth formation of the teeth also. No doubt. In extreme cases, no teeth. Where teeth are very weak and not having, it is, life is not there in the muscles. Then we can see calcare will handle it. Okay. Next. Malnutrition. That is impaired nutrition. Body will not assimilate the nutritious food. So they are weak. Malnutrition or impaired nutrition. The child will not try to walk because of weakness. The child will not try to walk because of weakness. Okay, next. A big bellied child, a big bellied child with emaciated neck will be poor, with emaciated neck and weak limbs, WEAK, weak limbs, LIMBS. A big bellied child with emaciated neck, weak limbs, and enlarged glands, and enlarged glands. Tonsils are enlarged. Something, glands are enlarged in calcareka. Beretta carp also we have this. Okay. But calcareka you can see big bellied child. I told you, not seeing the calcareka patient itself we can recognize. That is the first class symptom. Next. Cannot climb the stairs. Cannot climb the stairs because of weak bones and tiresomeness. Because of tiresomeness. Exostosis, EXOS, DOSIS, exostosis, EXOS, DOSIS. Exostosis are some extra growths under the skin. Extra growths under the skin. They are called exostosis. You will see that one ball-like thing moving here and there. Under the skin it will be there. In different places. May not be only hand. Somewhere here, somewhere here, somewhere here. Exostosis. Okay. Next. Extra gross under skin. Yes. Teeth grinding in nights. The child will be grinding the teeth. Sounds will come. Teeth grinding in nights. Next. Headache is a common symptom. Headache is a common symptom. When I say common symptom, it will be widely proved drug. Almost all calcaric patients will have headache. If they don't have headache, you can get them headache. How will you get them? You will ask them to not to take coffee. So if they stop coffee, they will get headache. You can make them get headache also. Okay. That is what is a common symptom. Yes. Next. Thick yellow discharge from ears. Thick yellow discharge from ears. Ears will have some discharge. Thick yellow discharge. Calcarea lady will be weak. Before preparing the food, she will not start, but starts weakness. I cannot prepare the food like that. But she will do. Definitely she will do. Chronic sore throat. SORE. Chronic sore throat. Always throat, some irritation, some problem, some pain, something. In children, They will omit the undigested milk. In children, they will omit the undigested milk. Milk they drink, but it will not get digested. They will omit it. Note down. If omits milk as it is calcarea. This is a very important symptom. If they omit the milk as it is calcarea. If they omit the milk as it is calcarea. Or if they omit curd after taking milk, it is ethusa. Aethusa. This you can see in nursing children, small month babies. They will omit. They drink milk and omit the curd. So inside they will have ready-made curd and they will put it for fermentation. Immediately they will omit. The curd is prepared within 2 minutes. Very wonderful. That is ethusia, Aethusa. In infants, months babies, they omit curds. Curd omitted, ethusia. Milk as it is omitted, calcarea. This you must remember. Okay. Next. Sexually weak. This is one symptom of calcarea, but lycopodium. Many drugs are there. Sexually weak. Okay. Then menses too early. Menses too early. In some cases, once in 15 days. Once in 15 days. So monthly they will have 2 cycles. Calcarea will have 2 cycles in a month. A healthy lady will have menstruation for every 28 days. Because menstruation is directly linked to the moon. Moon phases is 28 days. A healthy woman will go for menstruation for 28 days. 2 days this side, that side, no problem. If it is more, it is a symptom. We have to treat. Okay. Next. Profuse discharge. PROFUSE. Profuse discharge. Menstrual discharge is more. It's called profuse discharge. And best medicine for ladies having excessive discharges. Best medicine for ladies having excessive discharge. And because of that, they become weak. Such cases, you can treat them with the calcarea. Next. Feet always cold. Feet always cold. Some people will have palms cold. Some people will have feet cold. But always feet will be cold for calcarea. Next. Formation of cyst is one symptom for calcarea. Cyst. PCOD we say. Calcarea will have that. Okay. Formation of cyst. Next. Long-standing diseases. Calcarea will have disease very long-standing. They say that, sir, for the last 30 years, for the last 40 years. Once they say that word, we can give calcarea. And you can see them. They eat well. They're very stout. Everything is okay. But weakness, tiresomeness, those symptoms must be present. Okay, next. They crave to eat. They crave to eat indigestible things indigestible things like soil, chalk, etc. So some children will have the habit of licking the walls because they want more calcium, or they will be putting everything into the mouth. Small children who are just started crawling, they will put everything into the mouth. Calculator 30 wonders will solve the problem. Don't beat them, don't punish them. It's deficiency of the calcium. Don't punish the child at any cost. Find out the symptom. Let them take homeopathy. They will be normal. Okay. Only if you know homeopathy, you will not beat the child. For anything, mathematics weak, don't beat them. Put them on homeopathy. They will become normal. Next, aversion to meat. Bracket in bracket, note down for non-vegetarians. Don't ask Trivikrama Dvaipayana Char whether we have aversion for meat. Dvaipayana Char will not eat meat at all. For such persons, say aversion to meat. Don't take that as a symptom. Persons who are habituated to taking drink meat, they don't like kalkareka. Okay. Next. Longing for fresh air. They want cool air, fresh air. The symptoms are better in fresh air. Longing for fresh air. But sensitive to cold air and cold weather. Sensitive. There is sensitiveness, but also they want cold air. Not that cold, but reasonably good. Next. Cramps, CRAMPS. Cramps at nights. Next. Because they are sensitive to cold air, they will be wearing sweater and like that. Not on that point. Wants plenty of clothing. Wants plenty of clothing. Even though they are sweating. One side they will sweat. One side they will put the clothing. Too much clothing. Next. Aggravation from cold air. Aggravation from cold air. Wet weather. WET. Wet weather. Cold water. Cold water. From washing. From washing. Aggravation in morning. Morning. And aggravation during full moon. Aggravation during full moon. So these calculator patient symptoms aggravate during full moon. This is one symptom. Okay, Paurnami. Next. Better in dry weather. Better in dry weather. Lying on painful side. Next, VAP, very important. Sulfur should not be given. Sulfur should not be given after calcareka. Sulfur should not be given after calcareka. And lycopodium should not be given. And lycopodium should not be given before calcareka. Sulfur should not be given after calcareka. and lycopodium should not be given before calcarea. The cycle, the cycle is CLS. First calcarea, then lyco, then sulfur. Call it as CLS. In this fashion only, we should give calcarea, lyco, and sulfur. Okay. So this is calcarea carb finished. And now the time for question answers. Thank you very much. I hope you have understood. I'm going a bit slow because some people are asking if that's that speed we can't follow. So I'm going slow. Thank you.
Padmapriya, madam.
Satyanarayana,
Yes, sir. Padmapriya, madam.
you raised the hand, be ready. Your call.
మాస్టర్ గారండి నమస్కారం మాస్టర్ గారండి
Yes.
ఇప్పుడు ఇందాక మీరు లేడీస్ లో మెన్స్ట్రుయేషన్ గురించి చెప్పారు కదండి అది 23 days కి వచ్చిన అది క్యాల్కేరియా పేషెంట్ కిందకే వస్తారండి
If other symptoms tally.
ఓకే సార్
Totality.
ఓకే సార్
Next.
Kota Murthy.
Sir, I have got 3 questions. After
Yes.
marriage and after delivery, generally women become obese. So, in such cases, can we prescribe calcarea carb?
No need, not in all cases. Not in all cases. If other symptoms tally like weakness, terrible weakness, sweat is there, always doing some work. These symptoms, majority could tally. In that case, you can give. Not just on obesity, don't give.
Second question, you have said that undigestible food or items will be consumed by the patient.
Yes.
So, some people eat rice. For them also, we can prescribe calcarea carb.
There are other medicines like alumina that will consume more raw rice. Calcarea carb is also there, but it is more with alumina.
Okay, sir. Third question is,
Yes.
for aggravation, for full moon, it is calcarea carb. For new moon, what is the medicine, sir?
Silesia. It is another drug.
Thank you, sir.
Next.
Rakesh Kumar, sir.
Sir, good evening.
Parado.
Yes, sir, Rakesh Kumar from Dehradun. For actually last 2 classes, my hand raising button was not working. I don't know why, some technical issue was there. I wanted to raise the hand, but I could not do so.
Now you can.
So many questions were pending. Anyway, that's gone. So now my question is that, sir, this calcarea, lyco, and sulfur cycles,
Yes.
will it be applicable in a day if we give, suppose, morning calcarea, afternoon lyco, and night sulfur? Will it be like this, or first
This is called veterinary homeopathy.
sir, or this cycle will also be
Listen.
sir,
Morning calcarea, afternoon lyco, night sulfur is called veterinary homeopathy.
right, sir?
It is not for humans. For a
Okay,
human, the common rule is give 1 dose or 1 drug at a time and wait for the drug to finish its action.
okay,
You have given calcarea carb and you are not giving time to act. So
Okay.
because we are told CLS 1 morning, 1 afternoon, 1 night, it cannot be called as homeopathy. They are not
Okay.
homeopathy doctors, they are veterinary doctors. Many veterinary doctors are there in these classes. For
okay.
an animal, you can give like that, but not human.
Okay, another is my experience sharing with all the colleagues. I faced a problem with a child who was having red face, sweating heavily in the head at the night, and he was eating this soil. And also, they have a pet dog. He was giving this soil to the dog also, and the dog also used to eat very profoundly.
Yes.
So I gave calcarea carb to both.
Good.
Now both got settled, but this child again got the habit of eating the onion.
Yes. You go for
Then
two-
I gave allium sipa, so he
Mhm.
got rid of from that also.
Very good.
And for menses too early, once in 15 days, this also was a problem in a lady at Chandigarh. She was
Yes.
also treated with calcaria, sir.
Very good.
Thank you, sir.
Next, yes.
1 second, sir. Rakesh Kumar, sir. If you find any issue, if there is no technical problem, I analyze somewhere. But
Sir.
if you face that problem, just ping me a message in the chat for me. Then
Okay,
I'll enable the last moment after all the charts are over. That's all I can do it.
Okay, sir. Thank you so much, sir.
Or you can drop me a message in my mobile also. I'll inform the sir. No problem.
Thank you so much, sir.
Thank you so much. Sai Ram Dwivedula.
నమస్కారం మాస్టర్ అండి.
Yes.
మాస్టర్ మీరు చెప్పారు కదా టూత్ వీక్ అని, అంటే ఇప్పుడు పాల పళ్ళు ఊడిపోయాక మళ్ళీ రావడంలో కూడా చాలా డిఫికల్టీ ఉంటుందంటారా, లేట్ గా రావడం?
Yes. Calcium తక్కువ ఉంటే difficult.
ఓకే మాస్టర్.
Yes.
మాస్టర్
Next.
ప్లెంటీ ఆఫ్ క్లోతింగ్ అన్నారు, ఇది అందరిలో ఉంటుంది ఉండకపోతుంది కూడా కనండి, ఎందుకంటే కోల్డ్ అన్నది ఇష్టం ఉండొచ్చు, దానివల్ల కోల్డ్ వల్ల ఎఫెక్ట్స్ ఉండొచ్చు, కానీ క్లోతింగ్ ఎక్కువగా వేసుకుంటారు అనేది కొంతమందికి ఉండొచ్చు, కొంతమందికి ఉండకపోవచ్చు ఆ ప్రాబ్లం
Yes.
అనేది.
Yes. It is not a must.
ఓకే మాస్టర్.
Next.
థ్యాంక్ యూ.
Priyanka Bapatla.
Namaskaram, Master.
Yes. You are from which place?
Visakhapatnam, sir.
Second. Tell me.
సార్ ఇక్కడ మనకి డైజెషన్ ఇష్యూస్ ఉన్నాయని చెప్పి ఇందులో కంప్లైంట్ ఉంది కదా సార్, అది కాన్స్టిపేషన్ రిలేటెడా లేకపోతే పుల్త్రే నొప్పులు అలా రావడం ఆ కైండ్ ఆఫ్ సిమ్టమా?
Any symptom.
ఓకే. మళ్ళీ ఇంకొక డౌట్ ఏంటంటే సార్, ఇప్పుడు యాక్సిడెంట్స్ అవి అయినప్పుడు అప్పుడు కొంచెం ఎముకలు అవి విరిగి అలా ఉంటుంది కదా, ఆ పార్ట్ బలహీనపడి ఉంటుంది కదా, వాళ్ళకు కూడా ఇవ్వచ్చునా?
ఆ టైంలో పని చేయదు. అప్పుడు మనం ఓన్లీ బయోకెమిక్ క్యాల్కేరియా ఫాస్ క్యాల్కేరియా ఫ్లోర్ ఇవ్వాలి. కాన్స్టిట్యూషన్ కాదు అది. యాక్సిడెంట్ ఇస్ అన్ ఎక్స్టర్నల్ థింగ్ కదా.
బట్ ఎనీవేస్ కొంచెం అది వీక్ గానే ఉంటుంది కదా సార్ ఒకసారి విరిగాక.
Yes, calcareous fast you can give CP6X. Okay.
Okay, sir. Thank you, sir.
Next.
Krishna KSR.
Next.
Roshan Bhatta.
Next.
Lalita Hariharan.
एक्सेस ऑफ ब्लीडिंग के लिए कैलकेरिया कार्बन.
Silesia for the pneumo. Yes.
अच्छा. Because when I say I am not attend the class because of internet failure. That's why I am telling.
So my question is, I have only one question. So this can be used for obesity, the calcaria?
No, we cannot give only for obesity. Other symptoms should have.
Oh, other symptoms should be. So
Majority. Obesity is one symptom.
What could be the like obesity with more symptoms, like whatever he eat, it will be just remain in the stomach, not get digested, and you will have
to
less
study
feeling for exercise.
Who is talking? Roshan?
Yes.
Sir, Roshan Bhatta from Texas, sir. Dallas.
Texas. Listen to me, Roshan. We cannot prescribe one symptom, one medicine for one symptom. Always you should go for totality of the symptom. Getting all the picture of the total medicine person, you have to prescribe. And obesity is one of the symptoms of calcaria. Many drugs have obesity. You cannot come to a conclusion for all obese people, give calcaria. No, that is not homeopathy. You have to see the totality of this. Next.
Padma Priya.
Thank you, sir.
నమస్కారం మాస్టర్. అంటే ఇందాక ఒక డౌట్ అడగడం మర్చిపోయానండి. అంటే హోమియో ద్వారా బీపీ అండ్ షుగర్ కూడా క్యూర్ చేయొచ్చండి?
హోమియో ద్వారా మనిషిని క్యూర్ చేయొచ్చు, బీపీ షుగర్ చేయలేము.
బీపీ అండ్ షుగర్ అంటే కాంట్ బి. మనిషిని
క్యూర్ చేయొచ్చు, బీపీ షుగర్ క్యూర్ చేయలేము.
ఓకే సార్.
మనిషికి మందిస్తే వాడుకుంటే బీపీ షుగర్ మాయమవుతాయి. బీపీ షుగర్ కి మంది ఇవ్వాలంటే బీపీ షుగర్ తీసుకొచ్చి టేబుల్ మీద పెట్టండి. Always you can cure the person but not the disease. This question you will ask me after 6 months also. I remember. Next.
Sudharani Khatri.
Yes, sir. Sir, one point you said in girls who are fleshy, lethoric, and they grow too rapid. Here, lethoric, they have hemoglobin more. So how this has become a symptom, I did not understand here.
They become weak. They can't work more. They get exhausted easily, tiresomeness, all these things. Based on the symptoms, if you get the blood tested, hemoglobin will be more.
Okay,
CLS is right.
one more
SCL
thing.
also can be given. You can start with
Okay.
SCL also is.
Okay.
Next.
Okay. Bones bend అవుతాయని చెప్పారు కదా సార్. Sir, bowlex will also be considered as a symptom of calcarea?
Yes, it is one.
Bowlex?
Yes.
One of the symptoms. Yes. Okay. Yeah. Thanks, sir.
Next.
Ravi Kumar.
సార్ అది ఇందాక కోల్డ్ వెదర్ అదే కోల్డ్ వస్తుంది ఫ్రీక్వెంట్ గా అని చెప్పారు కదా సార్. అది అంటే ఎలర్జీస్ చాలా ఉంటాయి కదా, ఎలర్జీస్ కూడా కవర్ అవుతాయి సార్ దీనికి?
We don't go by disease name. We go by only symptom. Don't
అంటే ఎలర్జీస్
conclusion like allergy. Don't use the English terms with us. Okay.
ఓకే, అంటే ఫ్రీక్వెంట్ కోల్డ్స్ అంటే ఈ సిమ్టమ్స్ డస్ట్ ఎలర్జీ అండ్ ఎలర్జీ కాకుండా బికాస్ ఆఫ్ డస్ట్, సో అవన్నీ కూడా
cold because of the dust. There is another drug is there, Talcamara. There are many drugs out there. You have to study all the drugs. You have to study all the persons.
Okay.
Very difficult science, homeopathy. And very easily you can learn.
And confused also, very easily.
The confusion is one of the symptoms of homeopathy. Okay.
Okay, sir. Thank you.
You are really playing with me here, all of you. I am honored you are all hundreds you are playing with. Come on, next.
Vindhya, yes.
Good evening, sir. Actually, walking slowగా వస్తుంది అని చెప్పారు కదా చిల్డ్రన్ లో. దెన్ ఐ మీన్ కొంతమందికి మాటలు ఎర్లీగా రావు కదా సార్, వాళ్ళకి
that is also one symptom. Slow learning to walk, slow learning to talk also.
మరి బెరైటా కాదు సార్?
Beta carb because of the mind.
Okay.
He doesn't want to walk. He is having good muscles, everything, but he doesn't walk. Calcarea is having weak muscles, hence he doesn't walk.
Okay. Okay.
Mind is the medicine.
Okay, sir. Thank you, sir. And one more question, sir. CLS అని చెప్పారు కదా సార్, యాక్చువల్లీ calculate సార్ ఇచ్చాం సార్, బట్ ఆఫ్టర్ దట్ పేషెంట్ కి మీన్ వైల్ మన ఐ మీన్ మెడిసిన్ టు మెడిసిన్ మీన్ వైల్ వాళ్ళకి కోల్డ్ చేసింది సార్. సో ఆ టైంలో ఎలియన్స్ ఇవ్వచ్చా సార్?
Homeopathy ఇవ్వద్దు, biochemical. You can give nitrate salt 6x because when you give an homeopathic drug, it is working. Give biochemical to support.
Okay, sir.
Don't
Okay,
give
thank
another.
you.
Yes. Next.
Thank you, sir. Thank you.
Karunasri.
I want to talk to two people. Only old people are coming. I am already.
Karunasri.
నమస్కారం అండి. అది క్రాంప్స్ అట్ నైట్స్ అంటే అది
Karunasri from where?
హైదరాబాద్ అండి.
Yeah. Cramps generally will come in night only.
అంటే కాళ్ళు లాగటం అండి.
కాళ్ళు పిక్కలు పట్టుకోవటం తెలుగులో చెప్పాలి. పిక్కలు పట్టుకోవటం కదా.
అంటే నైట్స్ అంటే పడుకున్నప్పుడు పట్టేయడం అండి.
పిక్కలు పట్టుకుని అంటారు కదా, అన్ని క్రాంప్స్ అంటారు.
ఇంకొకటి అండి, ఇప్పుడు ఈ మెంటల్ సిమ్టమ్స్ అన్ని మ్యాచ్ అయ్యి ఈ స్వెట్టింగ్ లాంటి సిమ్టమ్స్ లేకపోతే అది కాల్కేరియా అవుతుంది.
సిమ్టమ్స్ కెన్ బి ఎలిమినేటెడ్.
ఓకే, ధన్యవాదాలు.
మెజారిటీ టైలిడ్ యు కెన్. నెక్స్ట్.
కృష్ణ కేఎస్ఆర్.
సార్, ఇప్పుడు 3 రకాల డ్రగ్స్ చెప్పారు, లైకోపోడియం, సల్ఫరును, క్యాల్కేరియా కార్బో. ఈ మూడు రకాల డ్రగ్స్ కదా. యాక్చువల్ గా ఈ మూడిట్లో ఏదో ఒక రకం కేసు మనకు వచ్చినప్పుడు ఆ కేసును ముగించచ్చా? ఖచ్చితంగా ఈ సైకిల్ ని ఫాలో అయ్యి మిగిలిన రెమెడీస్ కూడా ఇచ్చారా?
ఖచ్చితంగా సైకిల్ ఫాలో అవ్వాల్సిన అవసరం లేదు.
ఓకే సార్.
రైట్.
దేవకి ఓగిరాల.
నమస్కారం సార్, నేను హైదరాబాద్ నుంచి మాట్లాడుతున్నాను. మీ నెంబర్ కావాలండి ఒకసారి నాకు, అంటే నేను మెడికేషన్ కోసం ఒకసారి ఫార్వర్డ్ చేయాలి. నాకు ఎలా కాంటాక్ట్ చేయాలో
9404 డాక్టర్ శ్రీరామ్. 9404 డాక్టర్ శ్రీరామ్ ఫర్ ఆన్లైన్ కన్సల్టేషన్. నెక్స్ట్
హారతి శ్రీనివాసన్.
Good evening, sir.
Yes.
Mine is a theoretical question. Now you are explaining the details of our various medicines. This is to find out the constitution of the person.
Yes, yes.
For the last 10 or 15 years, I am taking homeopathy medicine whenever required.
Yes.
I have never taken allopathy medicine.
Yes.
I am not visiting any doctor, but my friend, he is practicing this homeopathy. He is also not a doctor, but he has studied a lot and he told me these symptoms also. Now for damn ready symptoms, suppose food poisoning is there, take Carcinogalbum. Okay, train pull baga vastunte, you take Carbovage. And in case you have farting problem, take Lycopodium. Or if you have a feeling that something is in your eye, but nothing is there,
that is called prescribing and therapeutics.
Aconite.
Therapeutics.
Same problem వస్తే without going to the constitutional this thing, whether straight away it can be fixed.
We can give therapeutics only when the problem is localized and when there are no many symptoms. Only when there are very limited symptoms, localized symptoms, and immediately required, it is an acute symptom, we have to go for such drugs. Whereas the constitution is for the total person, totality of the person, which will cure all the symptoms.
So rule is that in case we localize it, we can straight away give that medicine.
You can give one medicine in emergency, suppose. We can give 1 or 2 doses.
Okay. Okay, sir. Thank you.
Next.
1 second, sir.
Those who have asked to please down your
Aruna Prabhakar. Aruna Prabhakar. Aruna Prabhakar. Okay. Raju VS. Raju VS.
Sir, Aruna Prabhakar.
Yeah.
Okay, ma'am. Yeah, ma'am.
Can I speak?
Yeah, madam. Go ahead, madam.
Sir, you said the calcarea carb can be given for bow legs. Supposing when we give for small children, will the bowing get corrected or it will not further progress?
No. The constitution will be corrected.
Okay. Sir, one more doubt I have. After giving a high potency, after 10-15 days, can we repeat a low potency if required? Like, for example, if we have given arnica 1 for an old injury, again after 10-15 days, the child falls. Then can we give them 30 again?
We can give same low potency after one intercurrent remedy. We have many intercurrent remedies. So they given arnica, again arnica is required. You can give one intercurrent remedy like hypericum or ruta or rustax, like that 1 dose, then go down to the arnica 30. We call it as intercurrent remedy.
Thank you, sir.
Namaskar.
Raju VS.
Okay.
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 India,
thank
yes.
you, Satyanarayana. Thank you very much. We will close the. Any other doubts?
Only one, sir. Over, sir. Everyone is over, sir.
Sir, I heard Bryonia is also incompatible with the calcarea carb. Is that true?
Bryonia is also very deep acting drug. Calcarea carb is also very deep acting drug. Both will saturate the constitutions.
But one after the other can be given, or
symptoms, you have to see the symptoms. Suppose Bryonia you have given, person has become calcarea carb, total symptoms change to calcarea carb. Then you give calcarea carb.
Okay, that means it can be given.
Symptoms is the guide for us.
Okay.
Sir,
But
you are
I
right, sir.
heard it is incompatible after calcarea carb. That's the
Correct.
reason I asked, sir.
Bryonia calcare carb, there is no compatibility. No problem.
Okay.
Okay.
Question is, sir. Okay.
Okay.
I think, yes, sir. Thank you, sir.
Thank you very much. Yes, right. Good night.
Thank you so much, sir.
See you on again Wednesday for the
Yes, sir.
next. Bye.
Thank you so much, sir.